Is it possible to manage a particular women's health condition and at the same time transform your health completely? My name is Dr. Michael McCarthy. I'm a gynecologist, and today I would like to talk to you about uterine fibroids. The information I'm about to share with you will change your life, whether you are a man or a woman. Now, uterine fibroids are benign or non-cancerous growths in the uterus of a woman, and they can cause a lot of problems, a whole lot of problems: excessive pain, excessive bleeding, irregular bleeding, problems with achieving pregnancy, problems with maintaining a pregnancy, other pregnancy-related problems. They can press on the tubes draining your kidneys and cause problems with the kidneys. They can press on the blood vessels and cause blood clots. They can cause anemia, a lot of pelvic pressure. In short, they cause a lot of problems. And the challenge also is that the symptoms keep getting worse as time goes along. And these problems can have far-reaching consequences. They can affect your work. I've seen women who need to have many days off work because of uterine fibroids. And not just once or twice, but every month. And that can lead to loss of productivity, and that can even give you problems in maintaining your job. I've seen uterine fibroids cause problems in relationships. In fact, some people are not even able to get into relationships because of the size of their tummy. They already look pregnant, but they are not. And that can create a problem. What is wrong with you? What is going on? And the men are even scared. Can affect your relationships, even when the relationships are already established, and can create a lot of tension. They can even affect your family, preventing you from achieving the desired family size that you wish to have, and causing a lot of healthcare related costs and taking up money that you could otherwise have used for other things in your family. And of course, they affect your health, creating anemia, loss of concentration, insomnia, not being able to do the tasks that you think you should be able to do. Fortunately, it is just about 10 to 15% of people who have uterine fibroids who actually have symptoms. And also, it is possible to treat uterine fibroids. We could either just wait and see how they play along with you, whether they are giving problems or not. Or medications can be used to address the condition partially, or some of the symptoms that go along with the condition. Of course, many of us know that surgery in its various forms can also be conducted on this condition to either remove the fibroids or to remove the uterus or manage them in one way or the other. There are also other interventions and devices we could use to manage the symptoms of uterine fibroids or to reduce their effect. In fact, some of them are even non-invasive and quite interesting. But how common is this problem? Up to 20% of women in their 20s, up to 30 to 50% of women in their 30s, and over 50% of women above 40 years of age have this problem. Now, that is a very big percentage. And you can just divide it and see how many women in the audience may have that. It is more common in women of African descent, women with increased body weight, and also women who have other women in their families who also suffer from uterine fibroids. Now, if they are that common and that problematic, don't you think that we need to discover ways of preventing them in the first place? so that we are free of all these problems. And prevention here means stopping them from occurring in the first place, or slowing down their growth once they have appeared, or managing or treating them appropriately before they can give health problems. I would like to share with you 5 strategies to address this problem. And these 5 strategies can also change the way you see your own health in every other area of your life. The first strategy, which has been proven, is that women who are less than 55 kilograms in body weight are less likely to develop uterine fibroids. Also, women with a body mass index greater than 30 are also more likely to develop uterine fibroids and to have uterine fibroids that are growing at a faster rate. Women who exercise more than 7 hours a week also have slower growing fibroids as compared to women who exercise less than 2 hours a week. And so that shows you the importance of exercise in managing uterine fibroids. It has been found that alcohol consumption increases the risk of one developing uterine fibroids. It stands to reason that regular health checks will reduce your risk of having complications from uterine fibroids because they'll be discovered earlier and appropriate treatment can be implemented. One of the biggest factors in preventing uterine fibroids and addressing this problem is dietary factors. And here I would like to share 6 dietary factors that you should know. The first is that it has been found that consumption of red meat, processed meat, and ham causes an increased risk for uterine fibroids. Now, that is an avoidable thing. On the converse, eating more fish has been shown to help to reduce the rate of growth of uterine fibroids. As your mother always told you, fruits and vegetables are good for you. And the research also shows that a diet higher in fruits and vegetables leads to a reduction in the rate of growth of uterine fibroids. Green tea is also protective. In fact, some studies suggest that there may actually be a minimal shrinkage of existing uterine fibroids with the consumption of green tea and an increased quality of life. Unfortunately, it is not as massive as we think, where to shrink the fibroids and make them disappear. But that is something good to know if established much earlier. It's also been found that the consumption of vitamin A helps to reduce your risk of uterine fibroids. Some studies have linked vitamin D deficiency with an increased risk of uterine fibroids. And therefore, if you are deficient in vitamin D, you can have supplementation of vitamin D, and that will be effective for you. I must say that these interventions I've mentioned are so powerful that we need to understand that they can even transform the rest of our lives. It has been shown that if you put some of these individual and in combination into your lifestyle, they are going to help you to reduce a number of things in your life. Cancer prevention is one of the biggest that you can get off. Cancer is a worldwide leading cause of disease and death, and preventive strategies are not as simple. But putting in the interventions for uterine fibroids can actually reduce your cancer risk. It has also been shown to reduce your cardiovascular disease risk, hypertension, stroke, deep vein thrombosis, and so on, can be reduced by putting in these measures for uterine fibroids affecting the rest of your body. In fact, some of the elements I mentioned have been shown to have antiviral effects, like green tea has anti-COVID-19 effects. And that is interesting. There can be a reduction in fatty liver. And I see a lot of young people coming in with ultrasound scans and other symptoms, and the diagnosis ends up as fatty liver. So preventing uterine fibroids can actually address that. Some of the interventions have helped to reduce depression, reduce dementia, Alzheimer's disease, and other forms of cognitive dysfunction. In fact, some forms of sexual dysfunction are also managed by some of these interventions that I've just mentioned to you. It also helps to improve your fertility. One of the biggest challenges of fertility in Ghana is polycystic ovary syndrome, or PCOS. And these interventions I've mentioned to you are the keys that we use to manage this disease as well. Type 2 diabetes, sleep apnea, menstrual irregularities are some of the others that I can mention. And of course, it helps to reduce your health care cost. Now, we are in a technology conference today, and this is the CGTU, and it's all about technology. How has technology affected the management and treatment of uterine fibroids? There have been serious advances, and I will show you. Everybody's going back in time, so let me also take you back in time a little bit. And that has to do with this. The scope and evolution of fibroid surgery has changed over the years. The first slide shows open surgery, which has a much larger incision, as you can see. Newer technologies that have come up have allowed us to do laparoscopic surgery, minimal invasive surgery, which just have very tiny incisions into the body and helps to so carry out this surgery. And at the same time, give you a much quicker recovery. Thirdly, can you imagine surgery without surgery? Non-invasive surgery, such that fibroids are treated without actually carrying out a surgical procedure in the sense of cutting. And that is what technology can do. And that is what is available worldwide for this condition in this age, thanks to technology. So what do we take home from this? Having uterine fibroids is not a death sentence for you. Having uterine fibroids is actually a license for you to have a healthier life and to intervene and be successful. So take charge of your life and take charge of your health, even when you have uterine fibroids. Thank you very much.